Well, good afternoon, everybody. My clock says it is noon, and so we're going to go ahead and get moving forward with our Greater Des Moines Partnership Investor and Member Briefing. I think I know most of you, but for those of you who don't know me, this is Jay Byers, and CEO of the Greater Des Moines Partnership, and thanks so much for once again making time to join us today.
I go in every two.
Our updates. If I could ask everybody to please mute your Zoom, and we'll go ahead and move forward. So we've got a really exciting lineup for today, and a lot of great updates, just like we've done the last couple of weeks. So we're going to be you're going to be getting an update on our DSM Forward playbooks that we've been putting together and have released a number of those to the community already. We're once again going to be getting an update on our healthcare systems from our good partners and good friends at Mercy One and Unity Point. We're also going to be announcing a new program that's going to connect tutors and students. So something very exciting we've been working on, and look forward to that rollout as well. And then also Stephen King from the Des Moines Arts Festival will be giving an update on what's going to be happening with the Arts Festival moving forward. Before we sort of jump into our updates, I do want to highlight an article that came out within this last week. It was in Yahoo Finance, and really analyzing a new report by Moody's Analytics, a economic development research resource that we use on a regular basis here at the partnership. And Yahoo Finance wrote this article basically focusing on cities that are best positioned to bounce back from the COVID-19 pandemic, and DSM was listed as one of those cities that's best positioned, and really focusing on a number of different things, including our financial services sector, our high level of education, and a number of other factors as well. So just like we've seen in previous tough times and recessions, Iowa and DSM typically haven't had maybe the level of dips that maybe the coast and some other parts of our country and world have had. So it's, again, this is a really good sign in terms of our ability to be a leader in coming out of COVID-19 situation, and continue to focus on those things that have been our strengths in the past, whether that be public-private partnerships and regionalism and visioning, and most important, leadership, and a lot of that represented on the Zoom call today. So again, we're continuing to watch all these, stay on top of this data, and continue to develop these strategies moving forward together to continue to advance the DSM economy and get things moving full steam ahead again. So that being said, I'm going to turn it over to Tiffany Tauschak, our Chief Strategy Officer, for some updates.
Yeah, thanks, Jay. Thanks, everybody, for joining us today. The partnership continues to keep focused on keeping businesses in business, keeping people working, and keeping our community healthy. And we continue to have really strong metrics that are demonstrating the success that you have all been helping us achieve. So first, I want to share that the DSM Strong hashtag now has nearly 39 million impressions, which is just incredible. And thank you all for your help in helping us share that message. The DSM Local Challenge hashtag that we launched in partnership with Catch Des Moines has now more than 36 million impressions. So we continue to have really strong content that we're all sharing collectively as a region, and really appreciate your help in that. So of note, we wanted to specifically highlight, related to the DSM Strong message and initiative, that last week on Wednesday was the DSM Day of Thanks, where people and businesses across the region lit up their homes and their communities, their businesses, with red, white, and blue to honor the frontline workers. There was also an appreciation loop around some of our hospitals. We just want to thank everyone who participated. It was incredible to see so many recognizable venues in our community lit up. Special thanks to Mid-American Energy, the Iowa State Patrol, Polk County Sheriff, Des Moines Police Department, and the Des Moines Fire Department, all who made a loop around Iowa Methodist Medical Center, Mercy One, Des Moines Medical Center, Iowa Lutheran Hospital, and Broadlawns Medical Center to show their appreciation for those frontline workers. So in other storytelling efforts since COVID-19 pandemic started, we have had now 123 blog posts related to COVID-19 response and now recovery, and 23 podcasts. Actually, we're now at 38 podcasts that have either been published or currently in production. So continue to share really great content. Thanks to all of you who are helping us with sharing those stories. We've garnered more than 770 media placements, and again, really looking to tell those positive, encouraging stories. And I know Des Moines Register is on the line and will share with us another DSM Strong message that they will be sharing in the Sunday paper this week. So please continue to share your stories with us. We want to help and share your stories through all of our channels as well. We do have virtual events that we continue to host in addition to this weekly event, ongoing programming. We've had more than 40 already virtual events that we've produced. Thanks again for those that have participated in those. We're really shifting our focus to DSM Forward. So recovery strategies and helping from the employer perspective prepare for that reintegration as more and more are mapping out plans for their next steps as businesses and moving forward as a region. So a few upcoming events that I just want to draw your attention to before we do a deeper dive on DSM Forward. On Saturday, we will host the 3rd virtual market meetup for the Downtown Farmers Market, which is presented by Unity Point Des Moines. This event it's been really well received, and want to continue to support and connect those vendors with buyers. So encourage you to join us this Saturday, 8 a.m. on the Downtown Farmers Market Facebook page. This Thursday, tomorrow, we will host our 4th In for Lunch tomorrow at noon. That's on the Downtown Des Moines Farmers Market page. It's a virtual event featuring Brazilian twins. And of course, encourage you to grab lunch, some takeout, and participate in the DSM Local Challenge. This afternoon, today, we are hosting a virtual tour of the Undesigned the Red Line exhibit that will be presented by Polk County Housing Trust Fund. And this is at 1:30 today, and it's certainly worth your time. We encourage you to participate and invite your team members to participate as well. We'll be sure to post more about that in the chat so you can have access to that link. And last week, as you remember, we worked with a number of our community partners to launch the Small Business Recovery Grant Program. Applications are still open, and you can find that available on our website. We'll drop into the chat box as well, but just want to make sure that you are all aware and continuing to share that with all of your connections that we have that grant, the recovery grant, available through May 20th. So with that, we're going to shift gears here. Jay, would you mind start with giving an update on DSM Forward?
You got it. So DSM Forward Task Force is a group that we assembled. It's made up of the Greater Des Moines Partnership Board and Capital Crossroads leadership and some other community leaders. Really, the Greater Des Moines Partnership senior team had been working on sort of the framework of this for going on almost a month, and really looking at in terms of sort of what are the best practices out there in terms of opening businesses and how to do that in a way that's smart and safe and collaborative, and looking at best practices, whether that would have been through Boston Consulting or McKinsey or lots of other different sources as well, Brookings Institution. And then we also have engaged Baton Global. You heard from Matthew last week, Matthew Mitchell with Baton Global, in helping put together that strategy. And then working with that task force to help identify what are those smart and safe and collaborative strategies and industry by industries and best practices as we're looking at the recovery phase and opening businesses. And it's really important to put this into context that we worked very, very closely with our healthcare partners, specifically Mercy One and Unity Point Health, who are going to be, again, joining us today, but helping us guide through that process to make sure that, again, safety and collaboration are key. And then also working very closely with our government partners. So this is part of Polk County Emergency Management Recovery Plan as well, working within the economy side of it, and also very close contact and collaboration with the governor and the state in terms of what they're doing as well, and all other government partners. And so speed was key, and we moved very, very quickly in putting together these various playbooks. We rolled out 5 last week, and we rolled out more again yesterday, and we'll continue to roll out more through this week, focusing on different industry clusters. And so I'm going to turn it back over to Tiffany to provide an update in terms of the industry clusters that we've rolled out so far and what's coming next.
Yeah, thanks, Jay. So as Jay mentioned, we have now published 9 of the industry playbooks, and they include childcare, gyms, personal services, restaurants, retail, manufacturing, nonprofits, hotels, and then events, arts, culture is also one of the industry playbooks. So those are available on our website. We have additionally published 6 different business function playbooks. So those have key takeaways that are specific to professional functions that could be present in any business. So want to make sure you know that those are available to you, and we continue to add and update to these. These playbooks are meant to provide guidelines and recommendations. They are not prescriptive, and they do not include any specific timelines. As we know, it's really up to you and your organizations as far as what works best for you, and knowing that each organization is unique. So they also do not constitute any legal advice. So there's your disclaimers on that, but there's really great information. Again, this has been an expert-led process, and we want to continue it that way. So looking to you to continue to provide input, guidelines, recommendations as you and your teams are working on your own plans, as well as leveraging other plans. So we're currently in the process of adding additional industries to the DSM Forward playbooks, and in the next few days we will release playbooks for healthcare, grocery and convenience stores, education, government, utilities, agriculture, construction and development, and financial and professional services. So these are living, breathing playbooks that will continue to be updated regularly as the COVID-19 response continues to evolve and more information becomes available. So please be sure to check those out on our website and let us know if you have any feedback at all, or if there are any other tools that you believe would be helpful that we add for others to utilize as well. So thanks again, and Jay, back to you.
Thanks, Tiffany. Thanks for your leadership on this. And thanks so much. I know there's a number of you who are on the call today that are part of the DSM Forward Task Force. So thank you so much for your leadership and your time and the quick turnaround on all those. We really appreciate it, and providing us with that professional guidance and industry guidance and best practices. So thank you so much for that, for all of your leadership. We really appreciate it. And as I mentioned earlier, we are now going to have an update from our healthcare systems, like we've done on the recent calls we've had, and for me personally, these have been just incredibly helpful as the COVID-19 situation continues to evolve, not only nationally but here within the state and here regionally, and again, just really great partners with Unity Point Health and Mercy One. So joining us today, we have Carl Keeler with Mercy One and David Stark with Unity Point Health. And these guys always do a great job of tag teaming. So I'm going to turn it over to them and look forward to hearing today's updates.
And thank you, Jay. I think I'm going to start first. So we appreciate the opportunity to be with you today. Thank you for setting these up and allowing us to communicate what's going on from a COVID perspective. And we really appreciate all your work you've done to help set us in a great position to return to as much normalcy as possible. So did want to also say thank you for the DSM Day of Thanks. That was fantastic last week. Have had a lot of positive feedback from our caregivers and saying thank you for the group that did that. That was amazing. And this week for us, both Unity Point and Mercy is our hospital week. So as last week was actually Nurses Week, this week is Hospital Week, where we kind of celebrate all the work that everyone's doing. So we are in the midst of celebrating kind of the wonderful things that our caregivers have done over the past year. So as we go to the first slide with regard to the stats, I think Angie, I don't know. There we go. So as we look at the first slide, as you can see, over 81,000 people tested in the state of Iowa, over 12,000, almost 13,000 positive, with almost 16% of those total tested being positive. You can see below, about 1 in 38 Iowans have been tested. There's still a lot of work to do with regard to getting as many people tested as possible. We'll talk a little bit about that later on. And you can see about 1 of 242 have been tested positive. Do you want to move to the next slide? So this actually shows kind of the regional data. So overall, there's 385 total people that are hospitalized, slightly down from yesterday and slightly down from the day before. You can see how many people in the state are in ICUs, 143, also slightly down from yesterday, and how many people have been admitted over the last 24 hours, and that actually is a slight increase. Overall, the world fatality rate is right about 7%. The United States, the case fatality rate is right about 6%. And the state of Iowa, our case fatality rate is 2.24%. So although we want to do everything possible to make sure we're keeping, get people well, there are, unfortunately, with this disease, people do pass away, but our state has managed this extremely well. So kudos to all the health systems on how they've dealt with this and those frontline caregivers. If you look at our region of the 385, where it's 179 of those patients, with 44 being in the ICU within Region 1, that's our Polk County. We have had 5,600 recover, and so our hospitalization rate is right about 3.45%. So you can see when you hear numbers of people that are becoming positive, you can just do the quick math. About that 3.5% will need to be hospitalized of that number that we do see. So we've been working really closely with those. Want to just talk maybe a little bit about remdesivir. So there has been a lot in the media with regard to this drug, remdesivir. Now, it is not a cure, but what we're seeing, it does have a positive benefit if you take it early with some patients. We are seeing about a half reduction in their overall length of stay. And essentially what's happening is it's helping to minimize the viral load of those patients. So we're able to decrease that viral load and able to help people recover quicker. The state did receive, this is now being managed at a federal level for the doses of this drug. The state did receive 400 vials yesterday, and you need about 5 doses for each patient. So unfortunately, that doesn't care for too many patients, and that was distributed throughout the state yesterday. And a number of the organizations have started treatment on selected patients with regard to that. Unfortunately, that will last only a few days, about a week for the amount we have. Hopefully, we'll be in the queue to get some more. And then, again, that was distributed across the state for each of the different health systems. But we are seeing some positive benefit for those patients. So maybe with that, I'll turn it over to David, and he can also give an update.
Yep, Carl, thanks very much, and echo his comments about National Hospital Week. And I know we've got folks on from Broadlawns as well as the VA, and I want this group to, and many of you have been on each week, to continue to know the great coordination that we have done here in not just Polk County, but in the central region amongst all of our facilities with the Public Health Department. It is a little odd, as we've said each week, of talking about reopening when we literally are at our peak here in Polk County of hospitalizations. So between Polk County and Woodbury County, those are the 2 counties in Iowa that really stick out in terms of volume. You'd probably expect that. But I think we can do it in a very measured approach, as you hear the governor, and she talked today, just an hour ago, about opening up all counties on Friday for certain things like restaurants and barbershops. And I think the work that Tiffany, Jay, and Baton and others have been doing to prepare us is exactly the right thing, because we can do it in a measured fashion. A constant topic that comes up, and I'll talk just a minute about testing, that still is a big deal, and it still is a shortcoming in terms of giving all of you some level of confidence that you can get your team members, your employees, through adequate testing. It just doesn't exist today on a widespread basis. So we've tested in Iowa, and Carl showed the numbers there, about 2.6% of the whole population. That is almost spot on with where the national testing is in terms of the number of people. So for us to get to a point of testing 50, 60, 70% of our population in Des Moines, we'd need to consistently do 5,000 to 7,000 tests a day for a long time. So we've got a ways to go, and the availability of testing on a broad basis is still something that's at least a month, 2 months, maybe even 3 away. So doing it with those kinds of strategies about masking, social distancing, regular cleaning, all those kinds of things are going to have to be what you're going to need to do because there will not be that ability for those quick tests. The antibody test or the serum piece has also been talked about, and I think that will be helpful, but that is not a test that will define if you've had COVID-19. It'll show if you have antibodies, which we know are going to be good. We don't know for how long, but that test is a little quicker, and I think that'll get rolled out a little bit more ubiquitously here in the next number of months. There's certainly a lot of talk of ramping up production to be able to do those tests. So those are a couple of things that I think are yet to come. I think we are probably hitting our peak this week and next week and here in central Iowa. And I'll underscore something I've said in the past, and Carl said it as well. If you look at the statistics in Iowa, 87% of the people who have unfortunately died from this are over 60 years old, but 83% who have been diagnosed are under 60. So an interesting dichotomy of the kind of exposure, and we know it's the treatment is not, or the cure, the vaccine is not there, will not be there. So the game plan and the roadmap that the partnerships rolled out and that we've been following both at all of our campuses here, Mercy One, Broadlawns, VA, Unity Point, are ones that we know we're going to need to operate on over the next number of months. There will be a phase 2. There will be a second wave of this. We don't know when or how big, but it's something that allow us to plan for that and flexibility for that as well. So hopefully these continue to be helpful for folks, and I know I speak for Carl. We're happy to answer any questions and provide any other specifics or what are on people's minds today about this.
Okay, it looks like we have a question here. With social distancing changing our office and restaurant spaces, what will hospitals look like after COVID? Waiting rooms, hospital rooms.
Well, I'll take a stab at that, and then Carl can jump in. I think those are things that we already are working on. So I'll give you an example. Last week, we started elective procedures, again, on a very measured basis. And so that also introduced more people coming in. So we still are in the process and we still are limiting, discouraging visitors. Our waiting room areas have looked differently. So we've taken seats out. We've separated those out. We've also talked about how do we even manage our elevators and how many people in at a time. Where do you stand if you have to go up to a floor? And the same thing with our clinics. So each of our clinics, we have a online system that you actually wait in your car right now, and you will get a text message of when you come into your appointment. So you don't even go in and sit in the waiting room when you're visiting your physician. So those are the kind of things that a lot of those are going to be here to stay. So those are some examples, Creighton, I'd point to. And Carl, what would you add to that?
No, I think you're exactly correct. We have similar things that we've implemented here. I do think the use of virtual will continue to grow. We have done many virtual visits using Zoom and others in the patient's room. So as opposed to having those visitors coming up, we've done significantly more of those virtual visits. And quite frankly, it allows for people to join or have those conversations with their loved one anytime, as opposed to just by coming in. So hopefully we'll continue to do more of that, which is a positive benefit for those patients. If you can come in and visit and only do, for half an hour, or this way you can touch base with them much more frequently. So I think we'll continue to see that. And I don't see the social distancing piece going away anytime soon with regard at least to the hospital and your healthcare providers.
All right, thank you for those answers. Next question, I've heard this one a few times. Can the virus be transmitted via HVAC systems?
Well, the virus, the virus is transmitted via droplets, so it is transmitted in the air and can be on a surface. Most HVAC systems do have some level of filtration piece that if I find it very difficult for it to be transmitted through that, largely because of the distance, the length that it has to go and its ability to survive in the air, it drops very quickly and cannot be, that's why you hear 6 feet. A lot of times I've had that question, what's 6 feet mean? You know, why is that a magic number? Well, that's largely when each of us talk, me talking right now, Carl talking, Jay, believe it or not, we're emitting droplets. It's kind of gross, I know, and if any of you are eating, I apologize about that, but we all do. It's not just the sneeze, it's not just that, it's the droplets, and that is how it gets transmitted. Well, the droplets go right down, so it cannot get through a vent and then be transmitted that way. It doesn't really work that way, and so that's my my very unmedical opinion about it, but yet that's what I've been told by our folks here. And Carl, I don't know if you've heard anything different.
No, well, that was one of the first things that, you know, originally it was thought we had to have negative pressure rooms that would take air and directly out. But as they've done more study and evidence of it, how the droplets do move and how long does it stay in the air in normal circumstances, not specifically in a vacuum controlled environment, but as you look at in our environment, and that's why, you know, when you hear about better weather, it's not that the weather changes it's now not nice outside that changes the transmission and why you have a decrease of transmission. It's just that you're outside, it does, you know, you aren't touching all the surfaces and there's that decrease, but it has been seen that it does not go through the filtrations or through your HVAC systems.
All right, thank you for that. Again, heard that question pop up every once in a while. Next question is, and this one's going to be a little bit of a crystal ball question, but what will be the earliest indicators of when we might be seeing a second wave starting?
Carl, you want to take that one
yeah,
first?
Thanks a lot, David. That's mine. No, quite frankly, I think anyone on this phone probably has as good a guess as both David and I with regard to how that will be. You know, it really is, you know, the importance of making sure the quicker that we can get testing out and that we can, when we do identify that there is a positive, make sure they're following their quarantine process and not being wearing your mask and social distancing. That will minimize that second wave, but it is very hard to predict when that will be. You know, the state was doing great, and I think we had a very good early on, and because we did move, and the governor did move us to the social distancing and closing of schools and all those other things very quick. I think we've adapted. Our challenge has been in manufacturing. So our manufacturing, because, you know, it is harder to follow some of those guidelines, and that has been a challenge. But I think as we kind of continue to progress, it is hard. It is very hard to predict. You know, even just this first wave. Originally, it was supposed to hit us 1st of May, then went to mid-May, then went to end of May. Now we're looking at kind of 1st of June. So it is very, very hard to predict. The good thing is there's something called an RT factor that you look at the transmission, how it does transmit. And you can go, anyone can go on rt.live and you can see by state where we are. The goal is to be below 1. If you're below 1, that means if you get it, you're transmitting to less than 1 person. And when we started this, we were well above 3. Iowa had been at the far right, which means we are still transmitting higher than 1. We are now almost mid-pack. Over the last couple of days, our RT has gone down to a 0.91, which is very positive, that we are seeing that decrease of the transmission of COVID. So, and the further we get away from 1, the less transmission there actually is. So that has been a very positive sign over the last 3 or 4 days. We've gone from where we were right at 1, above 1, to now we are below 1. I don't know, David? Yeah.
Oh, I think that's an excellent answer, and you're right. It's, you know, crystal ball is a difficult thing with this. I do think that our medical organizations here will be the canaries that will see it as we see potentially increased admissions from, just like we start to see the flu with symptoms that in a clinic, coming into the ER, the hospital. And one of the things that we're doing now and we'll be continuing to do for a while that I think will help get us ahead of that is we're testing all of our inpatients. It's kind of a proxy. So even if you don't have symptoms and you come in as an inpatient, whether it's for a procedure or something else, we're doing the testing now, Broadlawns, Mercy One, et cetera. And so we've been doing that for a little while. So we have a small sample of an N, but right now we're hovering right around 2%. So 2% of the population that was asymptomatic that's coming in for something else has tested positive, means they've had it. And so if you use that as a proxy, well, if it goes above that, a little bit below, kind of to Carl's point about the RT, that'll give us some sense, but we still are learning about this virus. It's 5.5 months old, and so we just don't know, but we'll probably start to see it in the medical side before anybody else does, would be my guess.
Well, thanks for your predictions the best we can, and I think those answers make sense. Next question is, folks on the coasts in DC are getting the Abbott antibody tests readily. Any ETA for Iowa?
Yeah, we have some in Iowa, but in terms of getting them in a more broad fashion, I don't know when or a target for that. We've got some of those that some of the strike teams have taken those type tests, but we haven't seen much of any, at least in our organization. So I don't know if Carl has seen anything different. No,
we're the exact same. We haven't seen widespread.
Okay, we got two more quick questions here, and then so first one is, with businesses opening, what are your recommendations on face masks for employees and guests?
So our requirements here, if you come in, if I understood the question right, Jay, if you're coming into a medical facility, we require you to wear a mask. And it can be a cloth mask, it doesn't have to be a surgical mask or an N95, but we are requiring that as much as anything, just like I talked about when you're talking and all that, it just prohibits the spread of the droplets even more, and it's just one precautionary measure. It's not perfect, but it's better than not having it done.
And I would say, Jay, just partly because the asymptomatic person, it's about 25% of people with COVID are asymptomatic. And so even though you might not be exhibiting any symptoms, or you might think, oh, I've just got allergies, you may actually have it. So we are doing the same thing that all people that are coming in, all visitors have to have a face mask, and all of our employees all wear face masks. And it's a couple things. One is not only for you, it's for the people coming in, but also make sure you're not touching your mouth or nose. And that's the biggest thing, is it's you touching your eyes, mouth, or nose. You look great.
Hey, Carl, I tell you what, we all wear them. I'm wearing them too. So we don't do as we say, do as we do. So.
Yep. Thanks for the candid answers there. Kind of building off previous question, you're testing patients that are coming in. Are you testing hospital staff on a regular basis?
Go ahead, Carl, you want to start that?
Yeah, so we are not testing staff on a regular. If there are any staff that are exhibiting symptoms, we test everyone that is exhibiting symptoms, or if there was someone that came in originally was negative and did test positive. But every one of our staffs, actually all the healthcare providers, are all wearing shields, they're all wearing face masks, they're practicing meticulous hand hygiene. We did have an area where we did test a number of patients where we did find a positive that was a negative that did turn positive, and they had been in a unit for a certain time that was not one of our COVID designated units. We did test everyone there. So when we do see an area where there might be a potential outbreak or someone that did test positive, and again, it could be from community that they had worked and brought in, we will go and spot test, but we do not test all of our 8,000 employees, and partly because of again, access to testing. But even if we did, you would need to test your whole workforce every few days, or at least a couple times a week, just to make sure you're maintaining that. So we're following the CDC guidelines on how do we do this, and this is something that we collectively, all of in Polk County, we've all are following the same procedures. I don't know, want to add anything, David?
The only thing I'd add, Carl's spot on. The only thing I'd add is we are taking every staff's temperature every day.
Yeah.
So we are monitoring that. But again, the asymptomatic piece, he's right, still could be there. So we don't have that testing to do it. But if there is an exposure and we know that, we will get them tested like Carl said. So he was right on the money.
Thanks for that. And also regarding the previous question regarding masks, I would just encourage everybody to look at the playbooks for industry by industry, that those sort of guidelines are sort of included in there too. Final question, and this is going to be a perfect transition to our next topic, but Tom Ahart, one public school superintendent, what should K through 12 schools be thinking about in terms of in-person instruction?
Yeah, so I guess I'll start with that one. That one's a hard one as well for a perfect answer, but I think the same kind of things apply, and a lot of the playbook will help with this, but how classrooms are set up, I think will be important. I think where lunch is done, probably the lunchroom concept is not probably going to be feasible this fall. I think from how the cleaning process works, either between classes or during breaks afterwards, I think that'll be needed to be in consideration. Teacher up front, I think that can work. And the size of the classes may have an impact on some classrooms that couldn't make that happen. Passing periods are going to be tough with the interactions there. How do you maybe bring teachers to the students and switch that way? Maybe it's easier for a 3rd grade versus 11th grade. But I think those are some of the pieces that you're going to have to think through. And obviously there's a whole issue with extracurricular activities of groups together. That's going to be tough, whether it's speech, debate, drama, sports, band, etc. Those are going to be really hard to get started in a way that you feel safe. But from a classroom standpoint, I think those are some of the things, Tom, you're going to need to think about.
And it's just making sure you're practicing meticulous hand hygiene. They're going to go through gallons and gallons of
Great point.
Of this stuff. Make sure you have lots of that on hand, and so you're doing the hand hygiene, because that is going to be that critical. And if any really are monitoring if there are any children that are exhibiting symptoms, make sure they're not in the classroom, and that's going to be some of those key pieces.
Well, Carl and David, thank you so much. There's one more question from Bob Riley, but Bob, we'll follow up with you via email on that one. We need to move on to the next agenda item, but Carl and David, thank you so much for your leadership, and Unity Point and Mercy One have just been tremendous resources and partners for us, and also again a great reminder for thanks for working closely with Broadlawns and the VA hospital as well too. I think our community has just done a tremendous job with our healthcare industry, again, working together on the same page, and thank you so much for your leadership, and we really appreciate it very much, and thanks so much for making time for us today. We know how super busy you are. It means a lot to us that you're willing to dedicate time to us on a weekly basis, so thank you so much.
You're welcome. And Jay, if I can, Tiffany, the person that I haven't given a shout out to that really deserves it is Angie. She's put up with our last minute slides, pulled all these things together week in and week out. Angie, thank you for making it easy.
Man, and she has to work with me on a daily basis, which is pretty brutal.
I didn't say that,
too,
but
so.
that you said it, so.
Yeah, it's true. All right, well, thanks guys, and we appreciate it, and stay safe, and make sure to tell all your teams thank you as well for all the great work that they continue to do. We're going to move now to, we're excited to share information about a new program that we're going to be announcing public later this afternoon. It's called DSM Tutor Connection. This is an initiative where the partnership has partnered with Drake University as a pilot project to provide tutoring services to K through 12 students. The DSM Tutor Connection is a web-based platform that connects families seeking tutoring for their children with Drake students pursuing education degrees who are interested in providing those services. This effort helps address the challenges that many parents face as their children are participating in school from home during the COVID-19 pandemic. And I know I've got kids, and I know a lot of you have kids and have been dealing with that as well too. At the same time, this will help Drake students in need of teaching experience during a time when many of these internships and teaching opportunities are currently on hold. And our goal, as I mentioned, this is a pilot. Our goal is to expand this to students at other Greater Des Moines colleges and universities as the demand for tutors grow. And so that being said, I'm going to turn it over to Beth Niggett with EMC, who chairs our Talent Development Board, and by the way, is a classmate, or not a classmate, but went to Simpson College with me back in the day. So Beth, always great to see you. And Ryan Wise, who is now with Drake University. So Beth and Ryan.
Thank you, Jay. And yeah, just a few short years ago, our time at Simpson College. Well, thank you very much. I'm Beth Niggett, Executive VP and Chief People Officer at EMC Insurance Companies, and had discussed this with Mary Bontrager a little bit ago when she was providing me with some information with regard to the Des Moines Tutor Connection. And so very, very excited and pleased just to, again, highlight one additional avenue by which I think that the partnership continues to lead the way. And by that, I mean, it's thinking outside the box in taking a look at how we can create connections, how we can deepen those connections between our existing workforce and between our future workforce. And by that, I mean these students who will be serving as tutors, as well as the students who are in the K through 12 program, who can be taking advantage of these programs, and the parents or the guardians that are, really looking to get some help in regard to how to ensure that their kids are really getting the educational resources and guidance that they need. I know from my own limitations, I think by the time my kids got into 6th grade, my mathematical skills were pretty much tapped out. So this is a really, really nice way that we can make those connections between our business community, the educational institutions, and the future workforce. We know that before COVID-19, we had quite an issue in terms of the war for talent. Our unemployment certainly is increasing, and that trend is going to be a little bit different. However, I think what we need to be mindful of is always making sure that we are looking for ways to strengthen and deepen those talent pools and pipelines. And by making sure that we have a well-educated future workforce, this is another avenue that the partnership is really taking a very long-term, I would say excellent long game approach with how we make sure we really take a look at what that talent pool looks like. And as Jay had indicated, this is a web-based platform where tutors participating in the program can sign up through the platform. Parents that are interested in hiring a tutor can search the platform to connect with the tutors that they think would be a good fit for their student. All tutoring sessions are conducted online. Schedules will be created by the tutors and the families, so that the sessions really do suit the needs of both the student and the tutor involved. The other thing I would say is this is a great way that these students who are serving as tutors can continue to look for ways to earn an income if they're an education major. How can this continue to assist them in that regard of, while it's not an online or not a classroom in the typical sense, they're still honing their skills from a standpoint of being able to provide those educational resources. And again, it's focusing on the needs of the future educators who are being those tutors, and also supporting our K through 12 students and their families during this time. Just another way that the partnership is stepping up and really making a look at a very comprehensive way to demonstrate the value that it takes with respect to partnering all the way around our business community, the educational institutions, and those within our community. So I would say this particular initiative really does kind of knock it out of the park with respect to trying to look at how we might keep people employed from a standpoint of getting some funding streams coming in the door, and then also really trying to make sure that we're taking care of the needs of both the parents and the students within the Greater Des Moines community. I'd like to open it up and have Ryan make a few comments, and then Mary Bontrager. If we are missing anything with regard to these highlights, please make sure to fill in the blanks.
Well, thank you, Beth. I'm really excited as the incoming Dean of the Drake University School of Education to be able to help launch this exciting new partnership. And I will speak both as Dean of the School of Ed and as a parent of a 5th grade son and an 8th grade son in the Des Moines Public Schools. I know that our schools and our teachers are doing everything they can to provide ongoing learning support for their students when they're at home learning. And at the same time, we know that parents are trying to do everything they can to support their kids as they continue to learn. And I know parents are out there trying to find additional ways to provide that support, especially in areas that go beyond their knowledge, skills, and expertise. And so this, I think, is a great way to provide a service to parents who want that additional support. And at the same time, as the Dean of the School of Ed, I'm excited about the opportunity that this creates for our students. We already have 40 Drake School of Education students that have signed up to be tutors in this pilot launch of the program. And it's a great match between the skills that they have and that they're building and the need that parents have. And frankly, this gives our students an additional hands-on learning opportunity and an earning opportunity that they wouldn't have without this, while simultaneously meeting a community need. As you said, Beth, I think this is a great out-of-the-box, innovative, outside-the-box, innovative approach to supporting students' learning during a unique and challenging time. I really appreciate the partnership's effort in this area. I appreciate Mary Bontrager and all of the work she has done to put this together on a very short time frame. And I'm thankful you've reached out to Drake and our School of Education as the foundational partner in this work. In the last few weeks, I've had the chance to meet one-on-one via Zoom with lots of Drake Education students. And I will tell you, I'm incredibly impressed by their talent, their enthusiasm, and I think they'll be a great fit for parents that are seeking those one-on-one connections to support and supplement the work they're doing in supporting their own children's education. So we're eager to be partners in this effort and really thank the partnership for their work in putting this together.
Well, thank you so much, Beth and Ryan. Thank you for your leadership. And Mary Bontrager from our team, thank you for your leadership. Just tremendous vision on putting this together in a really short amount of time like we've been doing with our other programming, and looking forward to getting this thing launched this afternoon. So if you have any other questions, feel free to follow up with any of us or Mary. And I think Beth once again proved, and this is no shock to anybody, how she was a much superior student than I was during our time at Simpson. But that's something everybody already knew. Everybody already knew that anyway. So, so thanks for being with us today, and look forward to that rollout today. And again, thanks for your leadership. We appreciate it very much. Next up, we're going to hear from Stephen King, who is the Executive Director of the Des Moines Arts Festival, and we had to make a tough announcement yesterday, but Stephen is just a tremendous colleague and just a great leader, not only here in DSM, but globally, in terms of someone that people who run events look to, and has chaired his international association, and just a tremendous resource for our region. And look forward, Stephen, to your comments. And again, just want you to know we've been thinking about you with these tough decisions that we've all had to make, and you've just continued to provide tremendous leadership. Stephen.
Thank you. Thanks, Jay. Yeah, it's been a bumpy ride the last couple of weeks, so I'm glad we're here. But I wanted to add, Jay, to your report earlier. The Iowa Department of Cultural Affairs has been working with arts and cultural leaders across the state to develop recommendations and plans for reopening cultural institutions, festivals, live music venues. We had a follow-up task force meeting this morning. There were over 80 leaders from across the state that were on that call. It was that Zoom call. So that was pretty impressive. And I think a really important message that emerged from that meeting and for all of us is the reminder of the value of our cultural institutions. Considering the impact of COVID-19, it's important that we continue to remember them and keep them vibrant, and so that, and our nonprofit organizations as well, so that they can succeed, continue to succeed during this period, this downturn, and that they come out of this stronger. So it's important that we don't forget about them as we move through all of this. But directly to the Des Moines Arts Festival, just really, I think as most of you already know, we announced yesterday that we would be sidelining the 3-day event at the end of June. Just the very, very quick backstory, the executive committee of the board has been meeting regularly, a standing Friday morning meeting at 10 a.m. in which we covered everything from the numbers, the data, conversations with some of you that are on this call, just gathering as much information as we could so we could make an intentional, measured, responsible decision about going forward. I know a lot of people question why it's coming so late, but to us, it wasn't really that late. It was, if you know me, I'm going to lift every rock and turn every page. I'm not going to give up on it until I absolutely have to, but we had determined that May 15th was a go, no-go date for us, just based on a lot of the contracts that we have in place for the operations of the festival, which represents about 60 to 65% of our overall budget. So it was a huge expense that we were about to have to roll out if we pulled the trigger. So we knew that day was coming, and we did. But the good news is we've turned the corner. We have as a staff, have been organizing the festival in 2 different streams. One of those is a no-go stream, as well as the go stream. So in our no-go stream, we are working on are executing some community interactive arts related experiences and executing on our strategic priorities. I think if there is a silver lining in all this, there has been a lot of work in the last few years for the Arts Festival as an organization to take a hard look at its strategic priorities. And sometimes we get overshadowed by the veil of this big, beautiful, wonderful 3-day event. And this really provides us an opportunity to step out from behind that veil and execute on some of these strategies. So some of those include inclusion, arts year-round, playing a leadership role in advancing the regional cultural assessment priorities. And our most immediate our priority is to focus on expanding support for individual artists. And I can really think of no better time than to tackle this priority than right now. We are looking at the local administration and delivery of Artist Inc. Artist Inc. is a program developed by the Mid-American Arts Alliance. It's a live training seminar that is designed to address the business needs and specific challenges of artists of all disciplines. They provide training for peer facilitated learning, and participating artists learn business skills relevant to their art practice and apply those skills cooperatively with their peers. So it's a system in which this year we will train staff to be facilitators. We will train 5 artists in the local community to be facilitators. Those 5 artists will come back into our community and they will train 25 artists. And then those 25 artists will go out to the community and train 25 more. So it is a constantly evolving program that we are truly excited about in helping artists become better business people, becoming entrepreneurs. They have a really strong focus on strategic planning and goal setting. I think that is highly consistent with the regional cultural assessments findings. So we're excited that we're able to assist in aligning our organization with the work that was done with the RCA. So with yesterday's announcement, certainly it's difficult for us, but we know that there is a bigger setback to the visual artist community, to the performing arts community, the many vendors who support our festival operationally, the nonprofit organizations that rely on us for income and for marketing, musicians that play our stages. So While we may not be doing the festival, there are several programs that we have already initiated and pulled the trigger on that we're excited to roll out in the next month. One of them, a gallery show at Olson Larson Galleries that we will be executing with Chad Halfield, who's the founder and CEO of Silent Rivers Design and Build. We are executing the Interrobang Film Festival over the weekend of the Arts Festival, June 26th through 28th. So instead of going to the library to view those films, you can sit in the comfort of your home and on your smart TV, download Vimeo, the Vimeo movie channel, and look for us. Look for our channel, the Interrobang Film Festival, and we'll be executing the films, showing the films as well as the workshops and the programming. We're planning to execute the artwork by young artists as part of the student art exhibition. That will be on display at the Central Library as soon as the library reopens. We have already, we're executing what we're calling, excuse me, what we're calling At Home with the Des Moines Arts Festival, a video, we like to call it a video adventure, as we take you behind the scenes of the Arts Festival. We released our first video yesterday, which is available online on our website. And then we're also going to have a very aggressive outreach program to help support the many professional and emerging artists that were selected for the festival this year, so that we can continue to encourage our patrons and our festival guests to engage with them, to buy their artwork, to help support them as we get through this crisis. So that's kind of it in a nutshell. Thanks very much for including me today, Jay and Tiffany. Appreciate and I'm happy to answer any questions.
Thanks, Stephen. Really appreciate your leadership and your joining us today, and thanks for outlining what your pivot plan is. And again, a lot of thought has gone into that. So really great job out of you and your board and your team. So thank you for joining us and your leadership. Next up, we're going to be hearing from Shannon Welsh. Tiffany earlier talked about our update on our DSM Strong initiative and what we're doing for that storytelling. And the Des Moines Register has just been a tremendous partner on that. And Shannon Welsh specifically has just been really great to work with on that storytelling. So I'm going to turn it over to him.
Thank you, Jay, and thank you, Stephen. Pivoting off this, I think this uniquely is an opportunity for our young, maybe up-and-coming artists, much like my children. What the Des Moines partnership has brought to our attention and we've partnered on, which is a really great idea. This Sunday, we'll be launching a double truck, which is 2 full pages bound together, kind of back to back. It'll be a coloring exercise. So I imagine I've got children home myself, much like many of you. So this will launch Sunday. We partnered with 4 local artists who've brought some unique designs for this project. There will be a bio about each artist in the Des Moines Register. Laura Palmer, Ben Shue, Min Shen, and Jenna Brownlee. So look for this coming out in this Sunday's Register again. And the idea is that, children or, anybody really can color this. And then continuing with the theme of DSM Strong, post you or your child's finished masterpiece on social media using the hashtag. So I think with social distancing and the community message here, I think this will be a really cool initiative. And we look forward to rolling that out and appreciate the partnership and the opportunity to be part of this project. And thank you. Here's a quick snapshot of what you guys will see coming Sunday. So Stephen, you may have some artists you need to look for after these get posted.
That's fantastic. Thank you so much, Shannon, for sharing that preview. And I hadn't seen those yet. That's really cool. I'll make sure my kids color it, not me. So they've got the art skills, and my wife and my family. But anyway, thank you for your leadership. And we really appreciate the great partnership on all things DSM Strong with the Register. And Shannon, thank you for your personal leadership too. I'm going to turn it over to Tiffany real quick. We're winding up here. But we do have some action calls like we always do. There's always a lot that you can do to help us with the partnership team to advance these priorities. So Tiffany.
Yes, thank you. So just as a reminder, please watch for the DSM Tutor Connection information. We're going to be rolling that out publicly here within the next hour or two. That'll be available on our website as well. Reminder about the Small Business Recovery Grants, that's open until May 20th. Information is dropped into the chat box. Feel free to use that link to access additional info on that. We have the DSM Forward playbooks that we have launched. We continue to launch more. Really need to lean on you for web content, partnerships to highlight. Just continue sharing information with us. We want to keep those living and breathing documents moving forward. And in for lunches tomorrow, we have the virtual market meetup on Saturday, and then we have a list of other upcoming events and also podcasts that we continue to share. Those links are also available in the chat box. So hopefully I was quick enough for you, Jay.
Yes, great job. And thanks everybody for joining us today. Thanks for all the great things that you're doing out there. I've said this many times, but if there's anything that whether it's me or anyone on our team can do to help you individually, please call us, shoot us an email. If there's anything we can do to be helpful, please let us know. That's why we're here. We want to be as helpful as possible. I'm gonna leave you with a quote today. Stephen King and I were chatting a few days ago and just kind of talking about where this was likely going. And he dropped a quote on me, which I've used multiple times here in the last couple of weeks. And I thought he was going to use it, but he didn't. And it's by Dr. Jill Murray, and it's, "The comeback is always stronger than the setback." So I think that's, I think people are defined on how they pivot and deal with situations that come in front of them. And this is when real leaders are made, and you see what people are made of. So remember, comeback is always stronger than the setback. And remember that together we will be and continue to be DSM strong. So keep doing what you're doing out there and let us know if we can be helpful, and we'll see you next week. Thank you so much.